4 questions to ask a healthcare provider about asthma. Did you know that many asthma patients may be at risk simply because they're not asking their doctor or healthcare provider the right questions? The adage, "you don't know what you don't know," rings true when it comes to conversations about asthma. Here are 4 questions to ask for a helpful conversation about asthma during an appointment. Question 1. What are the signs of uncontrolled asthma? Most healthcare providers will ask patients if their asthma is controlled or how they feel in general. That may seem like an easy question to answer, but it's subjective, because what one person thinks of as controlled might not be. With chronic conditions like asthma, feeling bad all the time can feel just normal. But what if it's not? To find out for sure, patients should ask, what are some signs of uncontrolled asthma? The answer might be surprising. Question 2. Could allergies be triggering asthma symptoms? Potential allergic triggers are everywhere. In spring and fall, pollens flood the air. And all the year-round dust mites and pet dander lurk in the shadows. You see, asthma and allergies go hand in hand, which is why it's important to rule allergies in or out with appropriate testing. Patients with asthma should ask their healthcare provider to find out what exactly may be triggering symptoms through testing, and if a blood test is available to them. They can then work with their healthcare provider to know what is or isn't triggering symptoms in order to avoid or reduce exposure to them. Question 3. What medications may be appropriate and how should they be used? For both patients and healthcare providers, it's easy to keep doing the same thing over and over when it comes to taking and prescribing medications. That's why it's important to discuss asthma medications specifically during an appointment. Here are a few pointers. Bring all medications, including inhalers and spacers, to the appointment. Ask the healthcare provider to explain the difference between a controller inhaler and a rescue inhaler, as well as how and when to properly use each one. Take notes on your phone or take a photo of handwritten notes in case you misplace them. Question 4. What's my asthma action plan? Combine the first 3 tips by asking for an asthma action plan. These plans contain all the information someone needs to know about how to manage their asthma, whether they're having an acute attack or a normal day. They can also contain information about allergic triggers. If an asthma action plan is created for a child, it can be distributed to caregivers and schools. Having a plan in place helps provide peace of mind in case of an asthma attack. Having asthma doesn't have to be scary, and it's not always easy to talk to a doctor about it. But armed with these questions, a helpful conversation is right around the corner. Visit allergyinsider.com/asthma to learn more.